Good afternoon. My name is Ray Barceros, and I'm from 4 West over at Summit, our sister hospital here. And I just want to tell you, 2 years, 9 strikes, enough is enough. And we want a contract, and when do we want it? Now! Enough is enough. I'm fighting for my family, I'm fighting for you guys, I'm fighting for our patients. How many of us have worked such strong patients and having no help and no relief, no breaks? Come on, this is ridiculous. Enough is enough. Thank you.
We're setting, we're getting ready for our contract negotiations. Kaiser contract expires August 31st, 2014. What you guys do and what the outcome of this 9 strikes and maybe more would set the tone on how we do our bargaining next year. So we're looking up to you guys to set the standards. So on behalf of 17,000 Kaiser RNs, please keep up the fight. We will be with you all the way, because whatever happens here might be happening to us. So keep it up.
You take on one of us, you take on all of us. You take on one of us, you take on all of us.
Hi, hello guys, California nurses. I flew all the way from London just to be with you. I made it a good timing just to be with you on the strike. We are also working on the same thing. No cuts, no takeaways. But yeah, I really looked up. I salute you guys. You're doing a great things here. And I'm here to support the global unity for US nurses and UK nurses as well.
My name is Sandra. I flew all the way from London just to be here in this strike. We are also working hard on these same issues about cuts and no takeaways. And the US nurses are a good example for the UK nurses. I have a union, it's called Royal College of Nurses. That's my union back home. And they are also supporting us nurses, but not much as what you do here, guys.
So what are the issues facing nurses in the UK? I mean, the privatization, the attack on the healthcare system. What kind of conditions did you say?
Apart from privatization.
What does that mean in England for the nurses, or for the people?
We call it National Health Services, which work for all the public and community. But now they want it to be privatized, so we have to pay everything for that.
There's some unsafe conditions that are happening here, and the nurses are objecting to that. And in their objections, they're saying we need to fix this through contract negotiation, and as a matter of fact, that is not occurring. So the most important part is to bring it to the public, like what we're doing here today, to let the public know we're here. We're deeply concerned about what's happening here, and we want the support of the community to help the nurses.
Well, who does Sutter management represent? Why are they taking this hardline stance?
Well, it's really interesting is that some Sutter facilities have actually settled, but apparently this is not the situation where headquarters gives an edict to the rest of them. So this is a very recalcitrant one. Alta Bates is. They could have said, like Mills Peninsula has settled without significant takeaways and without significant damage to the patient and helping the nurses. This is not the case here.
How are patients being harmed by Sutter management?
That I'm going to have you talk to one of the nurses here, because I would be sort of just reporting something. I'm actually a member of the California Nurses Association. I head up nursing practice and patient advocacy.
Well, these non-profit hospitals are supposed to be ensuring that their patients are taken care of properly. And I mean, as a non-profit, do you really think that they're doing this as far as the practices?
The word non-profit is really a problematic wording, because in reality they are making profits. They just don't call it profits. We are deeply concerned. We have legislation currently about charity care. We don't believe that Sutter or any of the other facilities in California that are given a tax exemption are actually doing the charity care for the indigent and for those that are underinsured. So our concern here is it's like what kind of a responsibility do they have with the community, and how do they respond to it, and how do they meet the need of the community? The community is here, wanting to know is what you're doing. We've given you this authorization. What are you doing in return?
Well, is there any oversight by the government, by California departments, to make sure that they're not, that
yes, the Department of Public Health is an agency in California that licenses the hospital and also, does the enforcement. But as you probably know, there's always the budget is not necessarily there. So unless we really alert them that they need to come in, which we do, they're just out there, not actually coming in, waiting for a survey every 3 years, and that's how they do the oversee.
So you're saying there's no enforcement by the state of California?
I would say that I'm not saying that on the books there's no enforcement. I'm saying because of the budget cuts. You'll see them lesser in terms of being responsive to us calling them in and saying you need to investigate certain issues. That's the difference. It's like they're there. They have responsibility and accountability. But if you're not budgeted, if the budget is not there, then that's a concern.
Well, they have a budget surplus. Is the new budget include any more money for oversight of the
That I cannot answer. I hope that some of it will go part to enforcement. But most of the time, we're educating our nurses to enforce at the facility level, so that when they see a problem, to stop it right there, to control the issue and to stop it right there, instead of going outside for bureaucracy. And that's what the nurses have been attempting to do.
Do you think that these private people should be in charge of hospitals? I mean, what do you think that these people in Sutter should be running the hospitals?
That is a much broader question, and that is not something really that that I would be.
Well, what do you think about it, though? Do you think you should have these private people running the hospitals?
In reality, whomever run hospitals, they're accountable ultimately to the community, whether it's public, whether it's private,
like a private institution. They do what they want.
But there are other places that are private institutions, and they're actually doing a pretty darn good job being responsive to the community. In other places in California, in all reality, we have.
Which hospitals are doing a great job?
I'm not saying they're doing a great job.
Yeah.
I'm not saying all hospitals. You got to put their feet to the fire. But at least they tend to be.
Is like Sutter's a big chain.
Yes.
And you're saying that they're violating the rules, the state rules, as far as patient care and other kinds of rules as a nonprofit. Why should they? Yeah. Well, to
give you an idea, like they have a new electronic documentation system called EPIC. I don't know if you heard about that. Well, with minimal orientation and minimal competency, physicians and registered nurses alike, now this system is implemented. Now I'm getting a report from the nurses that whatever they purchase is not like the state of the art. It's sort of like it could use improvement. So the amount of time that is spent away from the patient in order to do documentation and get involved with the computer is an inordinate amount. So in other words, they're taking time away from the patient by buying this whatever software. Now EPIC is an accounting software. Now they're using accounting software and trying to convert it into a patient care software, and it's not it. So we are watching this. My department is watching this very carefully. We're collecting information to really do an assessment in terms of the extent of the potential harm and take away from the bedside that is occurring.
Story in Marin County?
There was a story in Marin County. That I will not comment on. That I cannot comment on that one. You probably have to ask somebody else. Are you familiar with our staff person in the communication, Chuck? Yeah, Chuck. Okay. That is the question for Chuck.
Well, the other issue is this computerization. It seems like the nurses and doctors are spending more time in the computers than they are taking care of the patients.
Correct.
Can you talk about that?
Well, here's the thing that we're doing an evaluation on. We're doing an assessment in terms of what impact does it have on the patient. For instance, a nurse who will identify that the patient, let's just use it as an example. I just heard it today. The patient has a rash. Now, when you do not do electronic documentation, you can define the rash, you can elaborate on the rash, but because this is a computerized system, all you got to do is click away and say the patient has a rash without any differentiation. So the concern that we have, it's override the judgment of the registered nurse, who is the ultimate safeguard, the ultimate safety net of the patient, but now they're too busy spending time instead of doing an assessment of the patient needs. But because here are
is there any investigation by the state?
No, it's too early. It's too early. They just started.
They're being installed. I mean, in other words, the state could investigate ahead of time.
They will not do that. They will not do that.
You think they should?
Obviously, it should be part of the plan to basically say, hey, we're going to put this in, and you know, we want to let you know that this is safe. We're going to go through your competency.
In other words, there should be an investigation before it's installed.
I would say, as a matter of fact, you know, I'm going to go even beyond this. I want to say that these are medical devices that actually should be approved by the FDA. You know, that's just, you know, it's like, that's where we're coming from.
Well, they posted a picture of a pig with a dollar sign, and then they listed all the nurses that worked overtime that they considered unauthorized. Now, this includes the time that they introduced the Epic computer charting, and in doing so, with 3 classes, you were supposed to be proficient in the use of this computer system. Though I have to say, Kaiser gave their nurses 9 days to learn it. Sutter gave us 3 days, and they said you should learn it on your own time then. So these nurses, in order to make sure that they charted everything and did everything right and did the right care, you know, they did incur some overtime. So Sutter's response is to put them on a poster board and designate them as pigs out for money, even though what they were doing for is looking out for their patients. Because this hospital is the first one to call you at home when some box is not checked, and making you come in on your own time to make sure that was checked. But not if you have to do that while you're working over, or that you're forced to stay over to give the right care to a patient. So they're just showing that it's the ultimate disrespect to nurses. Every time, everything we do is about the patient care, yet everything they turn it on is about money, which I think is just some kind of transference on their part, because their preoccupation is money.
Now, I understand this is an accounting program. It's not really even a program for...
Exactly. Epic was initially made to keep track of, to properly charge for patient care. And what they decided to is then adopt it to use as a charting system. That's why it's so vital for them that that Epic has become popular throughout the nation with hospitals. It's not because it's a better system to chart for the patient, but it's better for the hospital to capture charges.
Well, how is this computerization affecting healthcare? Because it seems like nurses and doctors are spending more time on the computer than they are with the patient.
Right, and many patients have said, you know, my doctor doesn't even look at me anymore. Even myself, my doctor is very nice, but I have to notice that half the time she's at the computer screen instead of looking at me. And I don't know about you, but when I talk to somebody, I'm talking to them live. And I can see when they're a little hesitant or reluctant, it tells me something about the patient. And when you're looking at the computer screen, you don't pick up that personal, you know, that hesitation they have that might mean that you need to ask something else.
So should the state allow this to go into healthcare facilities before investigating the effect it's going to have on healthcare?
Well, unfortunately, we have to admit it that JCO and the state, they're all complicit with these healthcare giants. That's the unfortunate thing. They're not really speaking for, like, for example, Alta Bates Hospital just passed with flying colors this JCO survey. And in reality, the survey, I mean, when we go to them and tell them about short staffing and how it endangers patients, they don't care about that. Mills Peninsula did the same thing. They went and privately met with JCO and said, there's all the things they're doing to us, short staffing us, it's against the law, this and that. And they listed all these things. And JCO said, thank you for coming to us.
Who's on JCO? Who does JCO represent?
Basically, Joint Commission of a hospital accreditation is paid for by the hospitals themselves. So it's a self-congratulatory body that it's the fox watching the hen house. You know, it's a fox paid to keep other foxes out, supposedly. And it's toothless. And the same thing with the state. The state comes in, despite numerous violations, the state just shakes their head, maybe gives them a $5,000 fine, all the while they've made hundreds of thousands or millions of dollars in profit off of these intentional short staffings and things like that. It's just really kind of the only people we can rely on is ourselves. I mean, and the public needs to know that they have to be their own advocates. We can't rely on the government. We can't rely on the hospital to police themselves. You have to stand up. Everybody has to to stand up. It's just getting, this is our 9th strike in 2 years. I mean, I talked to you a year and a half ago in a Grinch suit. And 6 months ago I was in the Grinch suit again. And the way it's going, I'm sure I'll be in a Grinch suit the following Christmas. I just don't see us really moving because it's in their best interest to break our union. And I think that's the way our country's going. Well, what we found out this time around for the scab nurses that they're bringing in, which is funny, is because many of the scab nurses were brought in to work with us while we were being trained for EPIC. And the wonderful thing about that is, once they came here and had to work under the same conditions we work with, they became constantly complaining about the work conditions here at this hospital. And one of our nurses was brave enough to pull one aside. She says, "I'm not here to start any trouble, I'm just making a comment. I happen to notice that you're complaining about how we're short-staffed and how you're not getting breaks." And she says, "Do you realize that's why we're going on strike?" And the scab nurse says, "Oh yeah, I see why you're going on strike." But did that stop her from coming back to this strike? No, because she's going to make $8,000 a week working our strike for 7 days, 7 12-hour shifts. She's going to make over $8,000. That includes free room and board, and it shows you that they're getting tight. This time around, they're not going to provide them free food. They have to provide their own food, though. Last time they got free food all around, and they provide them the free, safe passage to and from their hotels where they're putting them up for. And of course they get the ticket to and from wherever they're coming from, and usually they give them a $500 gift certificate. So it's really ridiculous that if you add up after 9 strikes all the money they paid to these scabs, they definitely could have paid for our sick time that they said they can't afford, that they can't pay for our ed leave, which they said they can't afford, that they have to cut weeks off our vacation every year. They can't afford that. They could have definitely afforded it. The bottom line for why they're being so intransigent with our negotiations is they want to break our union. That's the national trend, is to break unions, to make us powerless. And it's just this trend across the country. And that's why we have to take our stand here. Because some of the nurses that do not scab but just came to work with us with EPIC said, if you lose here, we're going to lose everywhere in the country. She said, I hope you really succeed here in California, because it's going to follow us to Massachusetts, to Ohio, to Chicago. So it's going to be very tough for us. We've got to win here.
Every time I'm on this picket line, and all of you know we've been out here together many times, I have to thank you for what you're doing for nurses and patients all across the country. It is phenomenal, the fact that you are willing to prevent the rollback of both patient care and nurses' standards. And you deserve praise and unity from all of us. And the children's nurses at our meeting yesterday have pledged to show up on each of your picket lines throughout the week to offer support and solidarity. But one more thing I want to say is this fight is not just about the hospital here. It's not just about Sutter, Kaiser, Children's. This is about a country that has decided to allow corporations and the very wealthy to run amok, to amass great amounts of wealth, and to take advantage of these difficult economic times to get you to agree to rollbacks and cutbacks. And you are out here not just for yourselves, for your patients, or for your immediate community, but you are out here for every working and non-working person that we support across this country. We cannot thank you enough, because nurses can lead the way in turning this around and making us a country that should be proud of our social and economic justice in our society. Thank you. You take on one of us, you take on all of us.
Deborah's right. It doesn't really matter who you work for. What it's about is really trying to take away the conditions that we have had and fought for, not given, fought for ourselves and for our patients and the community. And we are not, and I mean not, going to let that happen.
It's interesting. They have sleazy math when they're coming to figure out our pensions, our benefits, our salaries. and then they hire the best public accountants they can get to figure out their corporate salary, restructure their profits, and steal away from both nurses, our families, our community, and steal care from our patients, making our patients pay even more and more outrageous charges for being in the hospital. That's got to stop. And it's only going to stop because the nurses are out here talking about it day in and day out, that there is something that they can do about it, and that's the charity care bill, and that's key. It's going to be a fight to get it out in the legislature and to get it passed and signed by the governor, because the Hospital Association is going around hand in hand with one of their buddy unions, and I'll leave you to figure out which one that is, hand in hand, going around and saying that they don't need a charity care bill because they provide charity care. And you and I know that that's a lie. And so we want to make sure that they stop using the sleazy math to figure out how to mess over with our patients. I'm in public. And start actually dealing correctly with what care our patients get and who provides that care.
Take on one of us? Take on all of us! That's what I want to hear. My name is Jane Sandoval. I'm a staff nurse at California Pacific Medical Center, another Sutter facility. Woo! Sutter hurts communities. Let me tell you firsthand, they wanted to close my hospital. But guess what? We stayed solid, and St. Luke's is open today because of solidarity. Sutter says healing hands. Are you kidding me? Stealing hands. They steal from the community. They hurt communities. And what now? We plus you? We? Boo, Sutter! Yeah, we strike you, Sutter. Stay solid. In 2010, they wanted to close St. Luke's Hospital down. I wouldn't be here today if it wasn't for not losing steam, as the lawyer in negotiations wanted us to do. He just presumed we would lose steam. But all these years later, we kept the hospital open. It's being rebuilt the right way. And we got our contract too, so yes, it can be done. Stay solid. Do not give up hope. We were able to move this mountain called CPMC, and we did it. Stay solid. You take on one of us? You take on all of us. You take on one of us? You take on all of us. Stay solid.
I'm Koki Giles, and I have been on the board of directors at CNA NNU for 8 years. And I think it's because of CNA, all the work you guys have done across the nation, that you're looking out and asking me to come and join in with you as one of your presidents. 3 years ago, our hospital, first time a hospital ever went on strike, we did. And we were there, we're out, it was in November. It wasn't quite as nice weather as this, but we were able to go back to the table, and Maine was not used to having strikes go on. I think California sees that a lot more than we do. But we had the courage to do that because of what you nurses do out here. And if you're visiting in Maine or Massachusetts or Florida, it's so good that we're reaching out and getting all of these places to be union and to have good patient care and to be an advocate, because you might be in some of those places and need care for your loved ones or for yourself.
We respect ourselves. We're in it to keep what we have. We're in it for the future generations. I see that every day. I see it from, one of the nurses that I work with told me a story yesterday about how one of the doctors was going through the unit and talking to the parents about the fact that we were going out and saying, well, the nurses are going out on strike because they don't get enough money. So she pulled the doctor into a room and said, can I have a moment with you? And the doctor said, yeah. She says, we've worked together for 25 years, haven't we? Doctor says, yes. She says, we have mutual respect for each other, professional respect, right? I respect you, you respect me. Doctor says, yes, of course. a little worried about where this conversation is going, you know. So the nurse says, so I have to tell you, there's a rumor going around the unit that you're telling the parents that we're going out because we're not getting paid enough. We don't get enough money. The doctor says, no. Well, we heard you say that. Well, we need to talk to the parents. The doctor says, we need to talk to the parents about the fact that we're going out on strike. Okay, you can say we're going out on strike, but if you want to know what the real issues are, you're welcome to come to my union meeting at any time. She said to the doctor, you have only heard the side of the story from Sutter. We've been at this for 2 years. You've never asked me the issues. And I'll tell you, as a nurse negotiator, one doctor out of the doctors that I have worked with has asked me, and what are the real issues? We get the emails from Sutter, what's your side of the story? So that, to me, that example of that nurse sticking up to the doctor and saying, you know, if you're going to talk about this, talk about it with the straight facts. Don't walk around telling my community, telling my patients' families that we're in this for the money, because the money has nothing to do with it. It's about respecting ourselves. We see other examples of respect in the fantastic words that Ramon wrote. He wrote a beautiful Facebook letter about how we needed to, if we weren't going to stand up for ourselves, we had to do it because nobody else would, and we're not only doing it for ourselves right now, but we're doing it for the future generations. We see another example of that is in our unit we have the nursing students, and there was a nursing student from Summit Hospital with us last night, and we were in the break room, and she came in and sat down for a little while and was listening to us. And as she got up, she said, well, I have to go now, you know, I have to go home and do homework and get ready for my next day. But as she stood up, she says, thank you, keep it up, don't give in. We're doing it for her. We're doing it for her and all of her other people, all of her other students. So here we go. Right now, we're at RESPECT, 7 letters, 7 days. We are in it to win it. If it takes 7 times 7 times 7, we'll still be here demanding the respect that we deserve, that we have worked hard over years and years and years to earn. We cannot let them take anything away from us. What everyone says is true. The eyes of the nation are on us. The nurse from Kaiser who said, if you guys lose it, we're going to lose it. It's going to be a domino effect. And we need to continually remind ourselves the respect that we have for each other, the respect that we have for our patients, and the respect that we have for our community. That's what this is all about.
My name's Maria Boas. My mother's Ann Boas, who is a psych nurse at Herrick for 48 years. I was on my first strike back in 1968. So, these aren't new. I wish they would stop being here, but they won't give us what we need, and they want to take away what we have fought so long and so hard for, that it's just not fair. We need to be united. We need to stay the course.
If they can do it, we can do it.